Hello, Judith. Thank you so much for joining us today. You and I met last year through my research on postpartum hemorrhage and family planning in sub-Saharan Africa. And I learned about your amazing experience and career, which reflects a remarkable commitment to advancing maternal, newborn, and adolescent health across East Africa and beyond. From your early years as a district nurse in Uganda to serving as a UN volunteer midwife and tutor in South Sudan, to co-founding Better Health Care Organization and leading Better Women Health, your work has consistently focused on reducing maternal mortality and strengthening midwifery. You've also taken on executive leadership with PICSA Uganda, technical consulting and regional midwifery associations, and international training roles in India and Somalia. Across these experiences, you've blended community-level care with national leadership and global advocacy. I'm so excited to talk to you today and learn a little more from you.
Thank you so much, Larissa, for that wonderful introduction. Yes, I remain Judith Draleru Maturu, a mother and an advocate for women and girls.
Yeah.
So that we move together on the global health network for a better future for our world.
Yes.
Thank you for inviting me for this interview. It's my pleasure.
Oh, thank you, Judith. Okay. And where are you speaking to me from today? Where are you today?
I am speaking from Moyo. It is in West Nile. It borders South Sudan. That's the northern part of Uganda.
Got it.
And this is where right now I am based, working for partners in community social action as the executive director.
Yes. Okay, well, let's jump into it. I have a few questions for you today.
Yes.
First question. Looking back over your career from district nursing in Uganda to leading organizations and advising across countries, what moments stand out to you as the most defining in shaping your professional path?
Thank you so much. As you've rightly stated it, as a district nurse, that means I was rightly working in my community. That is Moyo district. I saw firsthand the impact of healthcare disparities on the communities. We well know that we have very many cases of maternal morbidity and mortality, the newborn morbidity and mortality, a lot of issues going on. So this motivated me to pursue leadership roles and advocate to improve healthcare services. And this has been my push, as from my experience, my mother was a near miss. That means she almost died giving birth to me. So what do? I have to give life to many. So that's what pushed me, that I should be able to fight and see that things go on. This has been my motivation. And then solving complex situations in the fragile conflict has been my a standout event. Imagine, through the bullets, you must save life. And it's very essential. And then connecting to the world, to people like you, speaking to those professionals, that has also encouraged me to move on. And then working on initiatives or the innovations that can pull out something. Like example, we had very many newborns dying in Juba Hospital. And we were wondering, when the newborns fail to start breathing at birth, we lose them. And yet it shows that they can be saved. So when we did the needs assessment, realized that the community health workers did not have the knowledge to give help for the babies at birth. So what we only did was to give them training, and we were able to save very many newborns. See, these are things that I feel when we put it in every context, we're able to move on. I think these are the very important moments that have kept me moving in the direction of good health. Yeah. Thank you.
Thank you. Next question. You've had leadership roles in many different contexts, from fragile settings to national level organizations. What have you learned from leading teams and building resilience in challenging environments?
Wow. It has been a wonderful experience. The most important thing for us is that courage and having trust Larissa, if I met you today in Somalia, I should be able to effectively communicate to you. You should be able to trust each other that we are together in solving this problem and we can do it. And then the most important thing is self-care. You need to care for yourself. Because when you're not mentally fit, when you're scared, when you're not health-wise okay, that means you will not be able to help the others. That means you have to be very okay. Even encourage colleagues. We can have through many ways of trying to work together. Even after work, if it means reading online, if it means singing, if it means dancing. So we used to have some dancing every Friday evening. We call it a plan B.
What do you call it?
Plan B.
Plan B.
Yes. Yeah. So that you okay. Yeah. We survive in every situation because we have one motive. So as a leader, if you have that courage, if you have that trust in your teams, and if you have that relationship that is binding, then you're a good team to go. You can handle anything. And of course, assessing everyone at their capacity. You could be very good in technical advice. I could be very good in just practical work. And then do we have gaps as teams that we need to fix? And then we can help one another to learn through. Moments appointed, we learn through, and the team remains strong and resilient. And the only way you can survive in a complex situation, or even in an emergency, is being resilient. Because you know that you are there to deliver service. Leave others. The bullets may even pass over you, you will not see them. And you still come out alive. So this is the courage of public servants. They work in complex situations and they must always move as a team.
Wow, I'm always so impressed when I talk to you about your positivity. Obviously, it's amazing, and you're talking about fragile environments, conflict environments. It's really not comparable to the classroom, but because students are going to be listening to this, and my students sometimes do group work and really struggle with it, I just want to point out to them who are listening now that thinking about all the things you talk about cooperation, about bringing in joy, about working together, filling in gaps, like helping each other. If you can do that in your situation, I hope they can remember to do that in their classroom group work too.
Yes, exactly. Because as they work through their classes, we do not understand at the same level. There are those who could be very good in some subjects, and then what you do is come up together and discuss. Actually, when you discuss, when you share, you have more knowledge. That's what I believe in. Because we are moving in a direction where we want to work alone. And it gives us that courage that we are moving on. Forget about first class, forget about last class. You may find somebody who failed will be the leader in the field. And with your first class, you're somewhere. So let's work together. That's how I encourage students. If it means even face-to-face sharing with them, as I did with the Boston Public Health University students last year in March, it's good for me. I can answer questions.
Yeah, because you're such an inspiration. And actually, that's part of the next question I see. What first inspired you personally to pursue nursing and midwifery? And how did those early experiences in Uganda shape your career path until now?
Yeah, thank you so much. I actually did not have a very good experience from childhood. But this created a good way for me to see that no one should pass through that. Because as I told you earlier, my mother almost died giving birth to me, and she survived. She's my hero. Up to now, I look at her as a role model for me, a woman who endured. That means I also need to be strong. And then during the Idi Amin War, that was 1979. You know, I was born in 1974. I'm old now. So yes, I was raped at the age of 5. Someone will say, well, they asked me, why do you feel proud talking about that? I said, there's no pride in it. But the good thing is I have grown up with resilience, and then to see that, 1, women and children must be supported. 2, young girls, even if in difficult situations, I normally ask people, do you see any sign of rape on me? They say no. They see a powerful woman. Exactly. Those people need help. and these gaps are there. Now you find in the cultural factors come in, maybe issues are not to be reported, it's a family shame. Then you need to give information to the people, come on, you can do this. We can do this together. Maybe you need to eat well for your baby to be okay. So we are there to bridge the gap between the community and the facility. People lack information. In our settings, because with the low education, with the poverty, that means we are there to stand as a bridge, that come on together, we can do it. And this is the purpose we are serving, because if these problems were not there, we will not be solving. Yeah, so they give opportunities for many things. So this growing up and where I've reached now, and where I've moved in conflict settings and saved lives, I feel I can work anywhere. One time when I told someone, can they give me opportunity to go and talk to the President Putin to see that?
And what did they say?
I was interviewed by ABC, that's Australian Broadcasting Corporation. So they didn't give me, but I will give you the links. But they
that would be great.
They managed to publish. Yeah.
That's great.
Because I was talking about how the Ukrainian women are suffering in the war, and yet they are giving birth to life. We are all very important. And that is the courage people should have. Actually, your students are in the right place. Public health is complex, but the best place to work in. We solve problems, and we are heroes. Yeah.
And it sounds like from the start of what you were saying that you can find inspiration or motivation even in the worst situations.
Yeah.
Thank you. Next question. During your years as a UN volunteer midwife in South Sudan, what were some of the biggest challenges you faced in strengthening maternal health services, and how did you overcome them?
Yeah, thank you so much. You know, South Sudan was a complex situation where by the time of their independence, they had only 8 qualified midwives. What does it mean? The mothers are being attended to by community health workers, by traditional birth attendants who had little knowledge. That's why it is one of the countries with the highest maternal mortality in the world. Because emergencies were not there. You know, the issue of postpartum hemorrhage, it does not give time for someone to survive. So there were a lot of these issues. So when we came in as UN volunteers under UNFPA, we were assigned to be mentors at the facilities. You had the duty to mentor the community health workers, the students. We were training students. Because I know now South Sudan has a very good number of midwives that have been qualified, and we managed to employ some of them as national midwives and also supervise them. If you ask me to bring an evidence for you to interview, I will give you one. And you want. So that is the beauty. So we kept working on the one. You're able to do meetings, you're able to do assessments. Then when you feel there are gaps, and then you sit down with this staff. One thing, you could only do something about PPH management, and or you go for newborn resuscitation, helping the babies breathe, or you go specifically for something. And then as a researcher, I also joined some teams that we were able to do a research, and we realized that the newborn cord infections were just due to using rudimentary, these traditional ways of cord application, maybe cow dung, soil, imagine. So, and yet WHO had already recommended use of chlorhexidine gel for cord care. We took advantage of that. And 2018, we won some money from Grand Challenge Canada as Better Healthcare Organization. And then when we concluded, actually right now we are doing scaling in South Sudan from that point.
Wow.
I still support. When it comes to trainings, I do go and do the trainings and also the supervision. That's the only thing now I can go and do in South Sudan. And then
is it still supported by?
We managed to reduce the cord infections. You can imagine. So your students at the seat, let them think of things that cost effective and they can be got. And the people can easily apply them, because these are tubes mothers can carry, even keep home and apply on the cord, and they're able to reduce cord infections. So and also when we formed Better Healthcare Better Maternal Women Health, my colleague lost a sister to PPH. She came to me and asked me, I said, Judith, sincerely, isn't there any simple way to save these women? We cannot continue losing them. Then I knew there's a policy that exists that we can distribute misoprostol for home births. And we were looked at like we are trying to encourage home births. And yet the fact is 80% of the mothers still deliver home. And then we explained, they said, aren't you promoting abortion? We said, no. We are giving this thing at 32 weeks if the mother goes with it. But in very far places where there's insecurity, they're unable to come. The community health workers can support them. But we encourage them to come and deliver the facility so that we help them. And we now distributed these misoprostols at the health facilities where the community health workers will be able to pick from the health staff, and the health staff in that area were able to supervise. And when this report came out, those who were saying we were trying to encourage something, they came in. So you've seen the resilience in an element and relying on a policy, a document that exists to defend you. Because in case of anything, you have something to refer to. So we were able to solve many problems and save many babies. So we've done very many things on just with the simple initiatives. So as I'm saying, as a public health student, think of innovations, new ideas, simply that can create an impact. If we go for huge things, even money is no longer there. Yeah. So it has been like that. Yeah, because poor infrastructure, poor roads, too much delays, mothers come actually at death points. And then even sometimes the resources for you to work in the facility are not there. So we used to also do mobilization from other partners, try to talk to them if they can support you with the gloves, those essential things. Mama kits. We managed even to get mama kits from Birthing Kit Australia. They used to send us. Yes. Just send it freely, come and help distribute and help the mothers. So there are many things out there we can do to create some difference. And I know as the maternal death from South Sudan came from 2050, it is now in 1,000. That means we are part of the contribution. We are part of the history in training midwives, in training nurses, in also trying to reduce the maternal newborn deaths, because we are contributing to that goal. Much as we are still far, I believe, and that's why I still connect to South Sudan Nurses and Midwives Association. I still connect to Somalia Midwifery Association because they need me. My knowledge is for everyone, because I have also moved to this level because of other people's knowledge. So you have seen you have a lot to do, and encourage your students not to fear. They have a lot to do outside here. Thank you.
Thank you. So for people who might be listening, who might be unfamiliar, you mentioned cord infection. So that's an infection of the umbilical cord on the baby, right?
Yes.
And you mentioned that there was traditional methods being used in South Sudan that were like using cow dung and dirt to cover that wound. And by using a gel that you were able to get, what kind of gel was that?
They call it chlorhexidine gel. Chlorhexidine, the disinfectant.
I'm gonna link that.
Just write it Abigail. That is a WHO recommendation that it should be included among the essential supplies. But still, I think recently I spoke to the director, Reproductive Health Minister of Health, South Sudan. I even have his recording I can give you. He clearly said they are ready to move on with that, but the challenge has been the funding to be able to bring a lot. But we are working with a scaling plan to see that we look for funding, at least scale it in the whole country, and you pray for us.
Of course. Yeah, you've just mentioned so many things. I just want to highlight for the students. You've mentioned a lot of international partnerships and funding support. You mentioned Grand Challenges Canada. Is Grand Challenges Canada still supporting that work that you mentioned?
We had a scale with them, which ended in July this year.
Okay.
Yes. Yeah. It ended July this year, and they're still looking at the reports. Maybe in the future they'll still consider us because we feel we've done a good job. They also
I
came
hope
for an
so.
audit. Yeah.
And you
That's our
mentioned
prayer.
the birthing kits from Australia. What was that organization you said in Australia?
They just call them Birthing Kit Australia.
Birthing Kit Australia. I'm going to just link these things for the students to read more about.
Yes, they supply kits everywhere. We were receiving in Uganda and also in South Sudan. Particularly, I was receiving the one of South Sudan.
Wow.
Myself.
This
They would
it's
just
very
post them.
interesting.
Yes, you just go and pick them.
It's
And then
really
you
interesting.
distribute.
Yeah, it's really interesting to learn about all these different partnerships and supports and how they help coming from external sources and how nothing would get done if you weren't there in person and on the ground to implement them. So I love hearing about all these different partnerships.
Yeah, because you remember in fragile conflicts, everything is not there.
Yeah.
That means
Yeah.
people come in to support. That's why it is a global problem.
Yeah. Now, to the next question, I could talk to you all day. But to the next question, I'm interested in your entrepreneurial spirit when you co-founded Better Health Care Organization and you later founded Better Women Health. What motivated you, Judith, to establish these organizations? I mean, you've talked about a lot of your motivation already, but what impact have they had on women's health in hard-to-reach communities?
Yeah, thank you so much. I told you I was already working in South Sudan, but I felt it wasn't enough. I needed something that I could be there to direct, you know, the the urge for leadership. And you feel you can create an impact because I've told you there were a lot of disparities, very far communities. You remember the staff that were posted because of insecurity may not be able to reach those areas. One thing, even payment for staff is not an easy thing. You get the point?
Yeah.
Then getting the resources, simple resources, even to support a mother during childbirth, you struggle with them. And these are people, maybe they're staying in camps. So we felt a community-led intervention was the way to go.
Yes.
Because where I was working, I was attached to the facility. It wasn't enough. Where do the problem comes from? The problems come from the homes, from the communities. And they normally come to you when it's very late. So the only thing we did was to be able to establish this organization to bridge the gap, move to the community, train the community health workers, go down to community for awareness, tell them what is happening, why the mothers are dying, find out from them why they are not reaching the facility. Because you'll find in some places, maybe you need 2 days to walk to facility. Maybe you have a river to cross, there's no canoe, the mother will suffer there. So we leveraged on the existing structures which were there, working through the counties. And that means we used to often have dialogues with families or the community, sit down and understand what exactly is the problem. If they are not affording anything, can they maybe just plant simple things? You can have a vegetable garden, be able to feed your family. And then you should be able to know where the facility is. In case of an emergency, you can't save your life when you're bleeding at home. The traditional birth attendant does not have the knowledge. It is the midwife who is in the far facility. That means also advocating with the counties, with the state minister of health and the national minister of health to see that these far places, at least they have a means of transport.
Yes.
The organizations who are working. So when you know them, you connect the communities that this organization, when you have a challenge, can transport you to the main hospital. So they just feel childbirth is a normal thing. And yet there are a lot of complications that have come in and they need help. So now they started this, they call them in South Sudan Boma health workers, but in Uganda they are called village health team. It depends on the country setting. So these are the people, these are the at community level, they're at village level. They're able to now identify this. So this is where Larissa lives. This is where Judith lives. In Judith's house, there's a pregnant, maybe young girl. We have a child who is supposed to go for immunization. So they take that advantage, visit home. And sometimes also we do go with them. Once while to see if they are doing the work okay. Yes, what support do they need? So time to time, you need to go and do supervision. Then you come and sit with them, down with them and see how far are we going. And this has been working for us.
Mm-hmm.
We've been able to see that women started going to deliver at the facility because they were going to receive their birthing kits. They had something to carry their babies with, yes. So the community health workers were there to tell them, come on, your time has come. You need to go for checkup. And then we looked at a situation that, in our setting, many are key. They own the resources. That's the fact in African setting.
Mm-hmm.
So for a mother to go for a checkup, she needs permission. She needs the money.
Mm-hmm.
And if the decision is delayed, then it is a problem. So we started bringing them in and telling them the dangers of leaving these women at home. Who will raise the children? So we feel that it's an inclusive decision that everybody has to come in.
Mm-hmm.
As people sit to wait for patients or clients at the hospitals, at the health facilities, there's a lot going on in the community that we really need to understand. So we are in a community-led intervention where they take lead in their issue, discuss, and see possible ways. What are the simple or effective ways that they can afford to solve their problem? If they say they will tie a bed on a bicycle to carry someone, that is the solution. It's an emergency. So community should be able to come up with things that support them. So basically for us, we know when you understand your community, you go with them. That's where the gap exists. Yes. Public health.
For the students or others listening, I want to just highlight from what you said that doing a public health intervention, trying to understand where the problems are and what can be done, isn't simply about just giving a medicine or making some kind of a clinic available. It's about thinking, can people get to the clinic, like you said, focusing on transportation in certain areas. And that's why having this local knowledge is so, so important, because someone coming in from the outside, how could they know all of the extension of these issues? You're talking to women and families from well before the time of the birth, the time of basically the potential emergency. So, wow, that's amazing. My next question for you is, having worked across Uganda, South Sudan, Somalia, and India, what insights do you have about adapting maternal health interventions to very different cultural and political contexts?
Thank you so much. When you look at every setting, now you see, I am used to the setting in Uganda, South Sudan, Somalia. But when I come to the US, I'm going to fidget. Maybe there's a lot of technology going on that I need to learn. Then in every setting, as you have clearly said it, one, the cultures of the people. For you to be able to move with them, understand it. And then you come to the issues of context specific. Okay, you find there are some locations where there's a lot of flooding, big problem. You find there's a lot of drought in some places, big problem, because when people don't eat, automatically the babies and the mothers want to be fine. You get the point? So what is the issue in that place? So whenever we move, let's contextualize issues. Where is the biggest problem coming from and why? Because the cause of issues in the US may not be the same as in the one in Uganda. Yes, yours could be maybe huge amounts of affording, but ours will be the lack of knowledge even of what is already existing. You get the point? So culture, context, specific issues are very important. Then politically, like in Catholic, they say, okay, family planning maybe not allowed. Then in another one, it's allowed. So what is the religious background? Because you cannot go and teach a Muslim community to eat pork to improve their nutrition. Very well knowing that they do not. So respect everyone is very important. They have their belief. The political situation, you also assess it. There are some moments when you can advocate for issues with evidence, but there are certain moments when you ignore certain things. But advocates will always speak. And when time comes, it will happen. So they should be blessed with How do these people live? How have they been living? Like, let me tell you, during cholera outbreak, it's terrible. People lose a lot of water and die. A public health person will say, okay, take boiled water. You go for a community awareness and somebody asks you, our great-grandfathers, we are not taking boiled water. Why didn't they die? So you have a lot of questions to answer to go through. Because like somebody tells you they have been, but you ask them, was there cholera in their period? Because I asked someone, okay, when we were born, there was no HIV/AIDS, it has come. How many times have you experienced COVID-19? They said once. I say, okay, did you know it would come? So there are certain situations that it is ABCD we need to follow. It's very important. So how people behave, what is their culture, what is their political environment, it helps you to be able to work. Just do the right thing. Yeah.
Thank you.
Because I know somewhere where I was talking about family planning and the doctor told me, please don't talk about family planning. Our people, wars finished them. Yeah. So you can imagine such situations. So, but the only thing is, what does the policy say? What is the right practice? We have SOPs around, and then it's a way of trying to engage people. Because when you are going as a public health person to people, there are very many who even already have the idea. Maybe they only have the attitude issue. So try to understand them. They will even tell you how they want it to be solved. And then you can now bring the scientific element. And it's a win-win situation. And when you get used to them, they trust you. Even if today you tell them something, they will accept because now they have confidence in you, they have trust in you. And we're there for a purpose. All of us have a reason to live and do something. Thank you so much.
Thank you. Now, this question is less about all the important work you do and more about the way that you share it. When I first came across your LinkedIn profile, I was struck by how detailed it was. It gave me such a clear sense of the range of your work, and it made me want to reach out. And since then, your responsiveness and willingness to connect now and before, even in simple ways like messaging or taking a call while walking through your village, have made it really easy to maintain our connection. So I was wondering, how do you think about using LinkedIn and similar platforms can make your work visible and accessible? I really would like the students to learn about this from you. And what advice would you give to students on using these kinds of online tools for networking and to build meaningful cross-cultural professional relationships in global health?
Yeah, thank you so much. You can really see that they already know. How did I connect to you?
Yes.
Yes,
How?
it's because you went somewhere and read about me.
Correct, yes.
And you believe, not knowing who this person is, you didn't care who I am and where I come from, but you say, okay, I think I can get something from her. I've also been connecting to important people like you, trying to sell my work. I even managed to go as a speaker, Cape Town International Maternal and Newborn Health Conference. It was 2023 May. I was there as a speaker. Somebody reached me. He said, I've seen your background. Are you ready? I said, I'm ready to go. Because I am always willing to learn. Even if I don't know, Larissa, I'll tell you I don't know, you tell me. And I will be with you. I will beat you in talking after you tell me. So the students should know that the first thing is always be ready to learn. Intentionally let them develop their LinkedIn pages. Yes. Put what you can defend. And people will look for you.
Yeah.
And then humility, being humble is the first step. You may go to a community where they will spit on you. You say, should I leave this work? No. Why is the person doing so? Because when you react, you box, you're already somewhere. Yeah? So humility counts very much. And learning the cultural context, being cultural oriented. You see? In your place, it is even to give a kiss or a peck in public. For us here, that is not allowed. Yeah. But still people do it because there's now a mix of culture. But then if you go into the village, there's no way you will attempt. I would have shown, I will send for you my photos. When I went to Somalia, I only left this face. I was dressing from it. I will send for you.
Yeah.
I had to respect that culture because I would fit there. But we're not saying you change completely. There are some laws that are strong, but there are those that are a bit weak, and then you follow because you want change people, then you'll be ready to change. So it's very important. So when they always understand also the local context, what is in Serbia, what is in Afghanistan, what is in Iraq. If I move to South Sudan, or when I work in New York, maybe if I work in the US, maybe the context in New York may not be the same as in Chicago. So what is happening there, as you had already said it, so it's very important. Ready to learn.
Yeah.
Yes. Understand people's cultural background, the religious, and understand the local context. And then they should just be there. They are ready to work. I know there's a higher being that will always keep watching over us. As we do good things, the good things will follow us. Even if we die in service, we would have created impact. And even in peaceful places, we die. The only thing is be ready and understand a community-driven thing. How can we support these communities? You come and do something wonderful. Imagine, Larissa, you're in Uganda. You just come and collect children to sing. They've been sad and they've developed that courage to speak. You have already done something. So life begins inside the womb. If all of us were not kept well, we will not be like this. Battery is going off. We have power outrage. If it is shut down, you know that it has gone off. But in case of anything, you can still get back to me.
Okay.
So this must be catered for.
Yeah.
Let's fight for the right of everyone. If you have a mother, you respect. If you have a sister, you respect. Then you should be able to respect your wife, and you should be able to respect other women. And the women, when they have brothers and fathers, they should be able to respect the others. So mutual living is the best thing to do. But for a public health person, we have a lot to swallow because we are going to handle a lot of situations to save life, and we must do it with humility and always be ready to learn and support one another, move together. Thank you so much.
Thank you so much. And Judith, just a last short question for you. How can students in public health make a positive impact on their communities and in communities farther away, like you have done?
You know, life is all about health. There's no development without health. When people are healthy, they will work.
Yeah.
And when people are not healthy, they won't work. And when we go more public health, we will prevent a lot of issues.
Yeah.
If we abandon public health, the medical people are going to wait for a lot of conditions and they don't have the drugs to work on. If we're telling people to clean their compounds, to maybe brush their teeth, you're already doing a lot of work. So it's a great, huge impact. And we feel there should be more of public health that has not been there. The world needs the public health officers more than ever.
Yes.
Yes.
So
because they'll have to do research, get the problems, bring on board, trying to get specific issues that are affecting the communities. And yet the others are waiting at the facilities and hospitals. But we are going down to see, why is the water contaminated? Why are the mothers dying? Why is there no food? Why are people malnourished? You get the point? So it's not, I think if any government should invest, they should invest more in public health.
Yes.
Right now we need. Yes.
So your advice to public health students is stick with it, be in public health, do research, work in public health, and that's where you can make a big difference. That's what I'm hearing.
Yeah.
Yeah. That's awesome.
My battery is shutting down. If there's anything, you can still get back to me.
Okay, sorry about that. Thank you so much, Judith, for your time. It looks like your battery shut down. Thank you, Judith.